Hi, I'll be showing you today in this video how a chin augmentation surgery or a chin implant placement surgery is done. A lot of men and women want chin augmentation procedure, and I have recorded other videos in which you can see who are the right candidates for chin augmentation. Now, someone who wants chin augmentation and wants a permanent result has to go for something called as chin implant surgery. It's a very common surgery which we do in our practice, and today I'll be showing you its surgical video. Chin implant surgery, the way I do it is by an intraoral approach. That means I do not give any incision or scar from outside the face or neck. As with any cosmetic surgery, the markings preoperatively is one of the most important steps. So we make the markings of the midline and at different distances on the chin so that it acts as a guide on the size of implant and the bone measurements on the table, on the surgery table, while we are doing the surgery. Once the markings are made, I do this procedure under local anesthesia or general anesthesia depending on patient's wishes. I do not make any incision or any cut on the skin of the face or neck. I use an intraoral approach, I avert the lip and make an incision by a very fine radiofrequency forceps. In the surgical video, you could see how the incision is made by the radiofrequency forceps, making sure that the surgery is bloodless. Making a bloodless surgery is very important because any amount of bleeding can cause increased chance of infection. Now, once the incision is made and the muscle is cut, we make a pocket over the bone. Now, this pocket is made using periosteal forceps. One has to make sure that this pocket is made of adequate size so that the implant can fit snugly into it. Making of a pocket is one of the most important steps of this surgery. Now, make sure that the pocket is made exactly of the size of the implant which is chosen, and the implant fits snugly into this pocket and it's not mobile and moving around. This is important because we want the implant to be fixed structure in that pocket. Once placed, I also fix the implant by different sutures. Before the placing of implant, it's also a good idea to wash this pocket by a triple antibiotic solution or betadine solution. I mix triple antibiotic with betadine and wash that area and the pocket absolutely so that there is minimal chances of any infection. Once the implant is placed, I fix the implants and then close the pocket in layers. This is important that you close the pocket in layers, repair the muscle and then the mucosa so that there is a watertight closure. The sutures used are absorbable stitches which do not need to be removed. They absorb over weeks to months. My patients after the surgery go back home the same day evening. They do not need any bed rest. They can eat or drink soft diet, semi-solid diet from the same day. Just making sure that after every meals and diet, they do mouth gargles and mouthwash, making sure of absolute good hygiene and there is no food particle deposited over the suture. You can see the result from the same day. It's a very gratifying surgery. A surgery in which patient happiness is always there. I'll be rounding off this video showing you some of our results, and I'm sure in each of the results you will be able to appreciate what an impact this surgery makes on facial aesthetics of each individual. If you have more questions about this surgery or any other facial aesthetic surgery, do write into us and I'll be there to help you. Signing off now. Bye bye.